Good morning, everybody. I would like to thank you for taking the time to review this presentation. My name is Manuel, and I'm delighted to share with you the findings and implications of my DMP project with you today. As you can see, the title of my project is Pre-Procedure Assessment using the Stop-Bang Questionnaire for Moderate Sedation Bronchoscopy Procedures. This project was conducted as a part of my Doctor of Nurse Practice degree at Maryville University. This project addresses a critical aspect of patient safety in bronchoscopy procedures. The focus is on improving outcomes by effectively identifying patients at risk for obstructive sleep apnea before sedation. During this presentation, we will explore the background of the project, the methodology used, the results obtained, and the implications for nursing practice and future research. I would like to acknowledge and thank my committee members for their guidance and support throughout this project. My committee chair is Maria Snell. My second reader is Dr. Rita Wunderlich, and my community member is Cassandra Wallanen. Their expertise and feedback have been invaluable in shaping this project. The primary objective of this project was to enhance patient safety and outcomes in bronchoscopy procedures. This was done by utilizing the Stop-Bang Questionnaire to screen patients for obstructive sleep apnea. By identifying patients at risk for OSA or sleep apnea, we can significantly reduce the complications associated with sedation during bronchoscopy procedures. Bronchoscopy, while minimally invasive, poses certain risks, particularly for patients with undiagnosed obstructive sleep apnea. These risks can include hypoxia, airway obstruction, and other adverse events during sedation. Proper procedural assessment can help to mitigate these risks and ensure safer procedures. The Stop-Bang Questionnaire is a validated tool that assesses for 8 different key factors of obstructive sleep apnea. They are snoring, tiredness, observed apnea, high blood pressure, body mass index, age, neck circumference, and gender. The Stop-Bang Questionnaire is designed to quickly and accurately identify these patients who are at risk for OSA-related adverse events. This project was motivated by a gap in current pre-procedure assessments for bronchoscopy patients at my institution. By addressing this gap, we aimed to improve patient safety and outcomes through better identification and management of obstructive sleep apnea patients. In the following slides, we will delve into the background, the significance of the problem, the methodology of the project, the results, and the broader implications for nursing practice and future research. Bronchoscopy is a procedure that allows pulmonologists to examine the airways and lungs using a bronchoscope. This bronchoscope is inserted through the nose or the mouth and advanced into the bronchioles. It is used for diagnosing and treating various pulmonary conditions. During the procedure, the bronchoscope provides a visual examination of the lung tissues, and in some cases it allows for biopsies or the removal of foreign objects. While the procedure is minimally invasive, it does carry some risks. The risks associated with bronchoscopy include hypoxia, bleeding, infection, and airway complications. These risks are particularly heightened in patients with undiagnosed obstructive sleep apnea. These patients are prone to increased complications during sedation. Obstructive sleep apnea is a common condition that affects a significant portion of the population. In some of my articles that I've read, it's up to 55 to 65% of the American population. Obstructive sleep apnea is characterized by repeated episodes of partial or complete obstruction of the airway during sleep, leading to disrupted sleep and reduced oxygen levels. Given the prevalence of obstructive sleep apnea and its potential impact on procedural safety, it is crucial to identify these patients who are at risk before undergoing procedures like bronchoscopy. The Stop-Aim questionnaire provides a quick and effective means of screening for obstructive sleep apnea, allowing for better management and safer outcomes. As I said, the Stop-Aim questionnaire consists of 8 simple questions that cover snoring, tiredness, obstructive sleep apnea, high blood pressure, body mass index, neck, circumference, and gender. Each positive, I'll show you the actual questionnaire on the next slide. So each positive answer scores 1 point, with the total possible ranging from 0 to 8. The scoring system helps stratify patients into different risk categories. A score of 0 to 2 indicates low risk, a score of 3 to 4 indicates intermittent risk, and a score of 5 to 8 indicates high risk. This stratification allows healthcare providers to identify and manage high-risk patients more effectively. Patients who score high on the Stop-Aim questionnaire are flagged for additional assessment and management by anesthesiologists during my project. This might include a more thorough evaluation or the implementation of specific measures to mitigate the risks associated with conscious sedation or moderate sedation. The primary purpose of the Stop-Aim questionnaire is to identify patients who are at risk for obstructive sleep apnea and its associated complications. By doing so, sedation nurses can tailor sedation strategies to enhance patient safety and outcomes. One of the strengths of the Stop-Aim questionnaire is its simplicity and ease of use. It can be quickly administered in a busy clinical setting without significantly disrupting workflow, making it a practical tool for pre-procedure assessments. As you can see, this is the Stop-Aim questionnaire, and the snoring, tiredness, observed sleep apnea, pressure, body mass index, age, neck circumference, and gender are all the acronym of the Stop-Aim, and these are the questions that were asked by the pre-admission nurses before the patient went to bronchoscopy. The lack of standardized pre-procedure assessment for obstructive sleep apnea in the endoscopy unit led to an increase in adverse events, including hypoxia, airway complications, and increased hospital stay. This gap in care needed to be addressed to improve patient safety. The goal of this quality improvement project was to implement the Stop-Aim questionnaire as a pre-procedure assessment tool to identify high-risk patients and reduce complications during and after bronchoscopy procedures. By identifying patients at risk for obstructive sleep apnea before sedation, nurses and sedation staff can implement appropriate interventions to prevent adverse events. This proactive approach enhances patient safety and improves overall outcomes. This project is a part of a broader quality improvement initiative aimed at enhancing the safety and effectiveness of bronchoscopy procedures. By standardizing the pre-procedure assessment process, this project aimed to set a new standard of care, gaining the support of key stakeholders including anesthesiologists, clinicians, administrators was crucial for the success of the implementation of this project. Their collaboration and commitment were essential in driving this quality improvement effort and the success of this project. This project employed a pre- and post-intervention design involving a retrospective chart review of 154 adult patients who underwent bronchoscopy with moderate sedation in the endoscopy unit at the acute care facility. This design allowed me, the author, to compare outcomes before and after implementation of the pre-procedure stop pain questionnaire. The study was conducted in the endoscopy unit in a rural hospital in the Pacific Northwest. The setting provided a representative sample of patients undergoing bronchoscopy procedures in a typical clinical environment. The study included adult patients aged 18 and older who underwent bronchoscopy procedures with moderate sedation. The patients were divided into two groups, the pre-intervention and post-intervention groups, both of which consisted of 77 patients. Data was collected on adverse events during and after the procedure, including hypoxic events, airway maneuvers such as head tilt, chin lift, or bagging procedures to help them breathe, lightening sedation, or aborting the procedure because of hypoxic events. This also included hemodynamic instability. The data points were used to assess the impact of the stop pain questionnaire on patient safety. Patients assessed using the stop pain questionnaire were categorized into low and high risk individuals. For the purposes of this procedure, we used low risk as a score of 0 to 3, and anything above 3 signified a consultation by an anesthesiologist. So the consultation and management from an anesthesiologist was to ensure safe sedation practices. Prior to the bronchoscopy procedure, patients were assessed using the stop pain questionnaire. This assessment helped identify those at risk for obstructive sleep apnea and potential complications during moderate sedation. Patients scoring high on the stop pain questionnaire were flagged for additional consultation with an anesthesiologist. This step ensured that appropriate measures were taken to manage their sedation safety. Data on adverse events were meticulously collected during and after the procedure. This included monitoring for hypoxic events, airway maneuvers such as head tilt, chin lift, as I said before, and hemodynamic instability like bradycardia and hypertension. We compared the outcome of patients in the pre-intervention group who did not undergo the stop pain assessment with those with the post-intervention group who were assessed using the questionnaire. Key data points included the occurrence of adverse events, the needed for airway maneuvers, and the episodes of any episodes of hemodynamic instability. These data points were analyzed to determine the effectiveness of the intervention. There was also some qualitative data that was received. The qualitative data received from nurses indicate improved confidence in patient safety due to the stop pain assessment. Patients reported feeling more secure, knowing their OSA risk was being managed. Staff observed fewer complications and interventions, highlighting the positive impact of the stop pain questionnaire on patient care. The implementation of the stop pain assessment led to a significant reduction in adverse events related to sedation during bronchoscopy procedures. This included a decrease in hypoxic events and the need to employ airway maneuvers. We used statistical methods, including the z-test for the difference of two proportions and the chi-square test, to validate the results. These tests confirmed the statistical significance of the improvements that were observed. Our analysis showed a notable decrease in the occurrence of hypoxic events, airway maneuvers, and other complications in the post-intervention group compared to the pre-intervention group. These findings highlight the effectiveness of the stop pain assessment. The results were visually represented in the following graphs, which illustrate the reduction in adverse events and highlight the positive impact of the intervention. These results demonstrate the importance of incorporating the stop bang questionnaire into pre-procedure assessments. It is a simple, effective tool that can significantly enhance patient safety and outcomes. And as you can see here on this bar graph, there's the number of adverse events. In the pre-procedure, there was 40 events, and in the post-intervention group, there was only 25. The use of the stop bang questionnaire significantly improved patient safety by identifying individuals at risk for obstructive sleep apnea. This ensured they received appropriate sedation management. The project resulted in a marked reduction in complications such as hypoxia and the need for airway maneuvers during bronchoscopy procedures. This underscores the value of pre-procedure screening for obstructive sleep apnea or patients at risk for obstructive sleep apnea. Statistical analysis confirmed that the improvements observed were significant and not due to chance. The validation supports the broader adoption of the stop bang assessment in clinical practice. Based on these findings, I recommend the broader adoption of the stop bang assessment in similar clinical settings, acute care facilities. This tool can enhance patient safety and improve outcomes across a range of procedures involving sedation or anesthesia alone. Future research could explore the application of this assessment in other procedural contexts and investigate long-term outcomes which can further validate its effectiveness. One key strength of this study is its robust design, which included a significant sample size and thorough data collection. The positive outcomes observed demonstrate the effectiveness of the stop bang questionnaire in improving patient safety. However, there were some limitations that we must consider. The study was conducted in a single center setting, which may limit the generalizability of the findings. Additionally, there may have been variability in how the questionnaire was administered by the nursing staff. Through this project, we learned the importance of stakeholder engagement and thorough training of the staff in the implementation of the new policy and protocol surrounding this new pre-procedure assessment and tool. Clear communication and collaboration were crucial to the project's success. Future studies could address the limitations of this study by including multiple centers and ensuring standardization of administration of the questionnaire. Additionally, exploring the long-term outcomes of patients assessed with the stop bang questionnaire could provide further insights. Despite these limitations, the project demonstrated that the stop bang questionnaire is an effective tool for improving patient safety and outcomes in bronchoscopy procedures. Its adoption in clinical practice could set a new standard of care. This project highlights the critical role of nurses in preoperative assessment and patient safety. By utilizing the stop bang questionnaire, the patients can identify high-risk patients and ensure they receive appropriate care. The findings of this project underscore the need for standardization of preoperative screening protocols to identify patients at risk for obstructive sleep apnea. This can help prevent complications and improve patient outcomes. Ongoing training for nursing staff on the use of the stop bang questionnaire is essential. This ensures that the tool is used effectively and consistently across clinical settings. Effective communication and collaboration between nursing staff, anesthesiologists, and pulmonologists are crucial for the success of such interventions. This project demonstrated the importance of multidisciplinary multidisciplinary approach to patient care. This project sets the stage for future quality improvement initiatives in the perioperative area. By continuing to explore and implement evidence-based practice, we can enhance patient safety and outcomes. Future research could explore the long-term outcomes of patients assessed with the Stop Pain Questionnaire. This could prove valuable insight into the sustained impact of the intervention on patients' safety and health outcomes. The applicability of the Stop Pain assessment in other surgical procedures and settings should be investigated. This would help determine whether the tool can be effectively used across a range of clinical contexts. Conducting large-scale multi-center studies could provide more robust evidence of the assessment's effectiveness. This would enhance the generalizability of the findings and support broader adoption. Integrating the Stop Pain Questionnaire into electronic health records could streamline the assessment process and ensure that it is consistently used. This would facilitate real-time data collection and analysis. Exploring the role of patient education in improving preoperative assessment and outcomes could be beneficial. Educating patients about the importance of screening for obstructive sleep apnea and its implications would enhance the engagement process. In summary, the Stop Pain Questionnaire significantly improved patient safety and outcomes during moderate sedation bronchoscopy procedures. By identifying patients at risk for obstructive sleep apnea, we were able to implement appropriate interventions and reduce complications. We addressed the need for standardization of preoperative assessments. We implemented the Stop Pain Questionnaire and observed significant reduction in adverse events. These findings highlighted the importance of pre-procedure screening in enhancing patient safety. This project underscores the critical role of preoperative assessments that ensure patient safety and effective care for patients undergoing moderate sedation bronchoscopy procedures, as well as pretty much any procedure in the perioperative area. By adopting evidence-based tools like the Stop Pain Questionnaire, we can improve patient outcomes and set a new standard of care. I would like to express my gratitude to everyone who supported this project and contributed to its success. Your collaboration and commitment are invaluable. I encourage the broader adoption of the Stop Pain assessment in similar clinical settings to enhance patient safety and outcomes. Together, we can make a significant impact on patient care. This is my acknowledgement. I would like to take this opportunity to express my sincere gratitude to everyone who supported and contributed to this project. Firstly, I extend my heartfelt thanks to the faculty and advisors at Maryville University, especially Dr. Maria Snell and Dr. Rita Wunderlich. Your expert guidance and mentorship and support have been instrumental in the development and completion of this project. Your feedback and encouragement have been invaluable, and I am deeply grateful for your contributions. Next, I would like to thank the staff in the endoscopy unit at Riverbend, Peace Health Riverbend. Your collaboration and dedication were crucial to the success of this project. From implementing the Stop Pain Questionnaire to assisting with data collection and patient care, your efforts ensured the smooth execution of this project and study. Your willingness to adapt and integrate new practices has made a significant impact, and I appreciate your hard work and commitment. I would also like to acknowledge the administration at Peace Health Riverbend for their unwavering support. Your provision of resources and encouragement fostered a positive environment that was essential for this project's outcome. Your commitment to enhancing patient care and safety is commendable, and I'm thankful for your backing. And a special thank you to all the patients who participated in this study. Your cooperation and trust were vital in gathering the data needed to evaluate the Stop Pain Questionnaire. Your involvement is greatly appreciated, and your contributions will improve patient safety and outcomes of future bronchoscopy procedures. Finally, I want to express my deepest gratitude to my family for their unwavering support and encouragement throughout this journey. Your patience and understanding and belief in me has provided the strength I needed to see this project through to completion. I could not have done it without your support. Thank you. And now I would like to open up the floor for questions or clarifications. Thank you.